Welcome to BusinessTraining.com. This video module is focused on the Mental Health Parity and Addiction Equity Act. This is our agenda for the video topic today. Please take a moment to review the outline. The Mental Health Parity and Addiction Equity Act was passed into law in 2008. This federal law requires covered employers that provide health plans to cover mental health illnesses and substance abuse on the same basis as physical conditions. The Mental Health Parity and Addiction Equity Act, or MHPAEA, amends the Employee Retirement Income Security Act and the Public Health Service Act and prohibits employers from providing health plans that impose stricter limitations or caps on mental health treatment or substance use disorder benefits that are not applied to medical or surgical benefits. The Mental Health Parity and Addiction Equity Act applies to group health plans that are offered by employers of 51 or more employees. The MHPAEA does not mandate group health plans to cover mental health or substance use disorder benefits. For employers with group health plans that do choose to provide mental health and substance use disorder benefits, the Act requires parity with medical and surgical benefits. Disclosure of any standards for medical necessity determinations and any reasons for denial of benefits relating to mental health or substance use disorder must be given on request. Parity requirements for mental health and substance use disorder benefits must be applied separately to 6 classifications of benefits, which are inpatient and outpatient in-network, inpatient and outpatient out-of-network, and emergency and prescription drugs. Plans that offer any of these categories, such as out-of-network coverage or prescription drugs for medical or surgical conditions and benefits, must also provide the same coverage for mental health and substance use disorder benefits, assuming that the plan offers benefits for stated conditions. The Mental Health Parity and Addiction Equity Act establishes several rules governing group health plans and mental health substance use disorder benefits. Again, employer group health plans are not required to provide mental health or substance use disorder benefits, but if they choose to do so, they must follow the guidelines established by the Act. All of these rules are assuming that the employer group health plan provides mental health and substance use disorder benefits, as well as medical and surgical benefits. Group health plans may not impose annual or lifetime dollar limits on either mental health benefits or substance use disorder benefits that are less favorable than any limits that are imposed on medical and surgical benefits. As well as the annual or lifetime dollar limits, an employer may not impose financial requirements or treatment limitations on mental health and substance use disorder benefits that are more restrictive than those given to medical and surgical benefits. This includes co-payments and deductibles, as well as the number of visits or frequency of treatment. Mental health and substance use disorder benefits may not be the subject to any separate cost-sharing requirements or treatment limitations that only apply to these benefits. All cumulative financial requirements, to include deductibles and out-of-pocket limits, must integrate both medical and surgical benefits and mental health and substance use disorder benefits into the deductible or limitation amount. The Mental Health Parity and Addiction Equity Act does not apply to small employers between 2 and 50 employees. Employers who offer a large group health plan may request a cost exemption to the MHPAEA requirements if they can demonstrate that compliance with MHPAEA increases their claims by at least 2% in the first year and 1% in subsequent years. Non-federal government employers who provide self-funded group health plan coverage to its employees may choose to exempt its plan from the requirements of Mental Health Parity and Addiction Equity Act and issue a notice of opt-out to enrollees at the time of enrollment and on an annual basis. Employers must also file the opt-out notification with the Centers for Medicare and Medicaid Services, or CMS. If you would like more information on the Mental Health Parity and Addiction Equity Act, please go to the Centers for Medicare and Medicaid Services at the following website. Thank you once again for your time and attention, and this is BusinessTraining.com, where you can earn a master's level qualification to make more money.